Audiology Clinic at Nova Southeastern University. I'm Dr. Elisa Needleman. I'm the clinical director and an associate professor here in the audiology department. We take you on a tour of the clinic. We have a full running audiology clinic here, so students get the opportunity to participate in activities directly with patients as well as practice on their own. Our faculty, one of the unique things about Nova Southeastern is all of our faculty work both in the classroom and in our clinic, so we get the best of both worlds, and everything we do here is focused on clinical application. So if we go in here, we'll find some of our preceptors. Hi.
Hi.
We have Dr. Davey and Dr. Andrews here. One of the nice things we have in our clinic is the ability to observe the students on camera as they're practicing with patients, setting up, working with patients, and not have to be on top of them in the room. So we can be working with them remotely. Okay, so first we have our two hearing aid rooms. This is our first one. We have modification opportunities. We can program hearing aids. This is also a room we would do counseling in with our patients. Here we have our second hearing aid room, and Johnny's in here setting up for his first patient of the day. We work with all different manufacturers of hearing aids, programming, modifications, repairs, troubleshooting. In the hall, we have 3 built-in sound booths for testing our adults. We have touch screens, so we can actually work with the patient while we're in the room, or we can work with the audiometer from outside the booth. Moving down the hallway, we have our vestibular room. We have a fully equipped vestibular evaluation room. We can do VNG, rotary chair, VEMP, VHIT. We have both air and water calorics. And our next room down the hall is for electrophysiology. We do evoke potentials in here, ABR, ASSR, middle and late potentials. We see babies from newborn who have referred on a newborn screening to doing a diagnostic evaluation. Nova Southeastern University's clinic is a pediatric center of excellence, and we've been recognized by multiple sites throughout the state. We have our pediatric testing booth. And Danny and Tasha are setting up for their first patient of the day. As we continue down, we've finished with our patient clinical areas, and we move into our laboratory space. Everything we have in the clinical areas, we have a duplicate of in the back for students to use, to practice, to take their lab courses anytime they want. So as we enter our primary, we have 2 patient test booths. One of our students is working on her assignments right now. And continuing on, we get to our hearing aid lab space. We have modification equipment. Here Lindsay's working with the mannequin to test hearing aids.
A carrot is a long reddish yellow vegetable which has several thin leaves on a long stem.
And a second hearing aid test room. Electrophysiology lab space. We can do ABR, ASSR exactly the same as we do in our primary patient space. We have a baby for simulation test purposes, otoacoustic emissions, and again we run our lab courses back here too. And then our final room is another vestibular evaluation room. We have a full table here so we can do repositioning if we need. We also have another full VNG system. Thank you for visiting our audiology clinic. We hope to see you here.